colic. It is the one thing on the planet that will level the playing field for all parents. I don't care how powerful, how successful, how accomplished or resilient you are, this will bring you to your knees. The average baby is hard enough. They can cry 2 to 3 hours cumulatively in a 24-hour period. A colicky baby, however, cries for, and I mean screams at the top of their lungs, at a very high pitch for 3 hours consecutively, up to 3 days a week for 3 weeks. That is the true diagnosis of colic. Now, unfortunately, 1 in 4 babies is diagnosed with colic, and that means you got a pretty decent shot of having to deal with this on your own, but you're really not alone, and that's the important thing to remember. And also remember that this will peak at about 6 to 8 weeks. It generally onsets about 2 or 3 weeks after birth. You're going to go through the tough time around 6 to 8 weeks, and then it tapers off by 3 months old. By 4 months, you are completely in the clear. Your baby's personality has emerged, and you are really enjoying each other and the season of parenthood. And they are so much easier to soothe. There are a lot of theories and books out there that speculate as to what causes or cures colic. But to date, there is no scientific evidence to prove any of the theories that are out there. We still don't know what causes or cures colic. The good news is that there are some things you can do to soothe your baby, keep them safe, and get your family through this really challenging time. The first one is don't be tempted to overfeed your baby. I know that with breastfeeding, we're not sure how much they're getting, and we're assuming they're crying because they're hungry. If we're overfeeding baby, watering down juices or giving them water, this can exacerbate the symptoms of colic. If you're formula feeding, there are some low allergy formulas on the market, but check with your pediatrician first before you switch formulas on your baby. If you're breastfeeding, we often assume that whatever we're consuming is causing babies fussiness or gas. The two big ones that really do affect breast milk are dairy and caffeine. But we must eliminate those for 10 straight days completely before you start seeing results and your baby feels better. Recent studies show that it's a big myth that eating cabbage, broccoli, beans, and spicy foods can affect your breast milk and cause baby to be gassy. So remember, focus on eliminating the caffeine and the dairy. Next, true white noise such as a fan, a hairdryer, or vacuum cleaner, or just shushing baby, can be really helpful. Also, swaddling can be very helpful for your baby. Movement is also incredibly powerful for them. Experiment with movements that make your baby feel better. It's going to be unique and individual for every baby. There is no one-size-fits-all solution or soothing routine for any baby. That's going to bond the two of you together, and that is the true essence of parenthood. Another solution I like to recommend is using a baby carrier. Letting them sit facing towards you with their legs up in the froggy position in that baby carrier helps relieve the pressure on their little tummies. It feels good to them. Also, keep the home environment as tranquil and peaceful and sort of spa-like if you can. We want the baby to feel relaxed. If there's stress and chaos in the home, your baby's going to be stressed out, and that really exacerbates colic symptoms. So keep it chill. And parents, it takes some trial and error. Be patient with your baby and be patient with yourself. We live in a society today where we are accustomed to instant gratification. And so you need to take some time to give yourself a break. Call a friend or a family member and have them relieve you once in a while so that you can refresh, recharge your batteries, get a clearer perception of things, and get some rest. This need to instantly solve the problem can tempt and pressure parents into using anti-gas medications, things with simethicone in them, or resulting to some homeopathic treatments that may not be safe for your baby. In fact, make sure at the onset of colicky symptoms or extreme stomach pain or what you might think is gas where they're screaming, call your pediatrician and have them evaluate your baby first and make sure that he can rule out food allergies, an ear infection, a scratched eye, a urinary tract infection, intestinal blockage, or even a hernia. Make sure that those are none of the things that are going on with your baby, and that will also help relieve your anxiety as you get them through the colicky symptoms. And finally, some great news. There are no long-term negative effects from having colic. You can get through this. Hang in there. I'm Jenni June. Enjoy your baby.